Thank you for joining us, and I appreciate your patience as we dealt with some technical difficulties. As you know, I am Dr. Noon Amin Ra. I am joined by Nu, and the topic of our conversation once more is autophagy. I should mention that I am presently in the final stages of editing the fourth tractate of Volume 2, which is on the Amen fast in connection with autophagy. And what I would like to focus on briefly as an introduction to our discourse is the relationship between autophagy and cancer. As you know, my primary emphasis has always been in the quarter century of the existence of the Amen regimen on prevention. And that is still my primary emphasis. However, it is not tenable to ignore the fact that many elements of the Amen regimen are applicable to clinical conditions, to diseases. And it would not be honest or ethical for me to ignore that fact in the interest of scientific conservatism. So, in this particular tractate, I focus on those aspects of the regimen that conduce to the mitigation of various cancers, in particular in the context of autophagy. As I mentioned in our last discourse, there is some controversy about the role of autophagy in cancer. It seems that autophagy can inhibit a great many cancers. And yet there are some cases wherein increased autophagy can have a deleterious effect. Now, this is in special cases, and I always encourage individuals who are using the regimen in a clinical way to confer with their designated clinician. And so my general approach and my general message is that on the basis of the evidence that I have analyzed, it seems that the induction of autophagy, the augmentation of autophagy, is conducive to the curtailment of cancer. And there are particular elements of the Amen regimen that are of utility in terms of the mitigation of cancer. And in this particular section, I focus not simply on the Amen fast, but those agents that we imbibe during and amidst the Amen fast that have a protective or therapeutic effect on cancer. And I should back up and mention that I am particularly interested in those cancers that are the most prevalent and the most deadly globally. And consistently in that context, we're talking about cancer of the lung, mammary cancer, colon cancer, and prostate cancer. And there are various agents that are included in the Amen apothecary, particularly those agents that are imbibed during the Amen fast, which research indicates has a potent effect on the suppression of cancer. And the agents that I tend to drink and recommend during the Amen fast are principally pu'er, which you see me enjoying here. I typically drink about a liter of liquid pu'er a day, I should say brewed pu'er. And additionally, I tend to have powdered pu'er during the day, mixed with cocoa betimes. That's one of the drinks that I enjoy during the Amen fast. Another is what we call the last Tirthankaras Trisula tea, and it consists of turmeric, ginger, and ginseng, typically North American ginseng, sweetened with stevia. The interesting thing about this combination is that every element of that particular tea, Trisula tea as it is called, has a suppressive effect on various cancers. And I discuss all of the elements in Trisula tea, the 4 different components that have specific effects on cancer. And I think it is important to understand that the severity of cancer will dictate how efficacious any of these elements are. And
Skaffa en Facebook-sida till sig själv och sin partner som. Oj.
pardon me, participants. Thank you. As I was saying, it is important to understand that the severity of the given cancer will tend to dictate the efficacy of the intervention, be it conventional or naturalistic, and that also obtains in the case of those elements that I discuss. And those of you who tend or intend rather to employ the Amen regimen, the Amen fast, the Amen apothecary, and all of its agents in such a way as to treat cancer in concert with a medical provider, I recommend that you acquire the forthcoming text that is Volume 2, Tractate 4, and analyze the studies that I cite and exposit quite extensively in the text. And that is my introduction. And what I mean to do presently is open up the forum for your questions, which Nu will field for me. You can feel free to text the questions, or I can open the mic if you would prefer to voice your questions audibly, and you may proceed.
Surprising. Okay. Okay. Our first question is from Jay Fernandez. He asks or says the pu'er tea is complementary in fasting.
I'm going to ask you to clarify, Jay, what you mean by complementary. If by that you mean that pu'er tea complements the fast, I would say yes. So there are elements in pu'er tea that I would say accentuate the effects of fasting. And by that I mean its fat oxidation capacity, its autophagy inducing capacity, its antioxidant effect, its anti-inflammatory effects. So in all of those ways, I would say yes, pu'er is an ideal complement to the Amen fast. Let me know if that answers your question.
Okay. Greg, do you want to talk about Brian's content?
No.
Okay. Jacob He asks, why is tyrosine not part of the elixir?
Tyrosine is not one of those approximately dozen isolated amino acids that I add to the almond elixir. It doesn't mean that it is prescribed, but the way that I conceive the almond amino elixir is that I selected what I consider to be the optimal proteins. That is isolated soy protein, spirulina, and brewer's yeast. And then I selected those particular isolated amino acids that were most efficacious for particular reasons. So in the case of the branched chain amino acids, it is leucine that exerts the most hypertrophic effect. So that is why leucine is a principal component in terms of the isolated amino acids. Glycine is the only amino acid that has been found to independently extend maximum lifespan in a mammal. So that is why it is included. Histidine is particularly potent in terms of its anti-glycative effect, and that's why it is included. Alanine combines with histidine to produce carnosine, which is another potent anti-glycative agent. So the principal reason for including most of the isolated amino acids in the almond amino elixir is for their anti-glycative effect. All amino acids have that effect. So the reason that tyrosine is not included is simply because, in comparison to other amino acids, it doesn't seem to have the same potency in terms of its anti-glycative effect. But again, it's not deleterious, and it can be included in your personal preparation of the almond amino elixir.
Jay Fernandez said, yes, it is a question, and I've seen you highlight the T many times. Yes, that was a sufficient answer. Much thanks.
You're quite welcome, Jay.
Duarte Valverde, what is the most salubrious type of puer tea? Does its aging affect the benefits? Should we aim for a maximum variety of teas in general on our intake within a day, or instead aim for variety within a whole week?
That's a good question, Duarte. Um, I would say that it is difficult to discern the most salubrious type of puer tea without becoming a connoisseur, so to speak. I've been drinking teas for over a quarter century, and I tend to frequent only a few tea establishments. The type of puer tea that I drink is one that is aged for over a dozen years. And the research that I've seen indicates that the longer the fermentation process, the more beneficial medicinal molecules are produced. But I have seen research that indicates that infusing particular microbes, fungi in particular, into the pu'er processing method can produce the molecules that are of greatest benefit, including statin-like molecules. So that aspect of your question, I would say that I would simply choose a variety of pu'er that you find to be palatable. It will have most of the beneficial properties that are discussed in the research. I think that um, age is an important part of the ripening process of pu'er, but I do not want to recommend an expensive variety of tea that will not yield greater benefits than one that is more economical. So I would say let your palate and your means dictate the type of puer that you select and simply integrate it into your daily fasting regimen. The other component of your question was about variety of teas, and I definitely would recommend that you integrate a multiplicity of teas that have beneficial effects. So, in this particular tractate, in the fasting section, I discuss all of those teas that I tend to drink, and they include not only pu'er and trisolite tea that I've already mentioned, but rhubarb tea, peppermint tea, and a variety of other teas. So all of them have benefits, and I would say, and I did not mention oolong tea, which is one of my favorite teas. Um, and I discussed that at length in volume 4, tractate 2, especially in the context of its ghrelin secretagogue properties. And it is a tea that I commonly drink on powerlift days, either before or after powerlifts. And many of the molecules in these teas have been found to have a very beneficial effect on sarcopenia or muscle atrophy. I know that this is a discussion about autophagy, but I think this is a relevant point too, because as you know, autophagy entails the catabolism of tissue and proteins. So it might be thought that because atrophy is associated with catabolism, that anything that induced autophagy would tend to reduce muscle mass, muscle strength, but quite the opposite has been found. That is, it has been found that a minimal degree or optimal degree of autophagy is essential for maintaining muscle mass and muscle strength. And that is also something that is of relevance in the in the context rather, of cancer and cachexia. That is, there is a need to promote the preservation of muscle mass and muscle strength. And many of these autophagic agents that we've been discussing and that I discuss in the forthcoming tractate inhibit cancer, augment autophagy, and also suppress sarcopenia and muscle atrophy. So I hope that answers your question about teas, Duarte.
Okay. Soul Rebel says, I drink GABA oolong tea. What is your take on that?
I'm not familiar with the adjective GABA. If you could expound on what is GABA oolong tea, I might be better poised to answer your question.
It stands for gamma amino butyric acid.
So,
So it's just a specific way they process the leaves.
yes, I'm familiar with that agent. I'm not familiar with any tea that has particularly high levels of GABA as a consequence of its processing, but I can look more into that.
Is it good? Okay. Georgie says, Puer seems to be a strong, caffeine rich drink. I try to limit the overall amount. 1 liter is both too strong, caffeine, and too much fluid. Would you think that a few grams, i.e., a cup per day, would have the same beneficial effects? Is there a so called minimal effective dose?
Those are good questions, Georgie. What I would recommend is that you consider powdered pu'er. it is more potent, obviously, than the brewed kind, but it will permit you to determine the amount that is good for you, conducive to you. So you can make it as strong or as weak as you like and still get the beneficial properties. In terms of a minimal effective dose, I would say that depends on what you're using it for. So in this conversation, we are talking, or I have been talking about cancer. There are specific studies which indicate that particular components of poor T and I won't elaborate on those two particular compounds. But if you are trying to replicate the effects of those particular molecules, I would suggest that you go to those particular studies that I cite in the forthcoming text. But for preventative purposes, there is no minimally effective dose. I think it's important to determine the effect that agents have on our body for particular purposes and use that as the principal guide concerning how much to ingest and when. So I hope that answers your question, George.
Yes, thank you so much. Yeah.
Quite welcome.
Okay. Excuse me. Alfonso asks or says, I've noticed that having my daily feast earlier in the day lowers my heart rate before sleep and improves sleep quality. How does this align with or refine the evening eating protocol?
That is a good question. And my question, Alfonso, would be how early in the day are you feeding? Um, as you probably know, I alter the time of my feeding largely in concert with the seasons. So when the days are shorter, such as in the winter, I tend to feed at an earlier time. And I basically endeavor to ensure that feeding is roughly aligned with sunset. So it is, of course, permissible in the context of the regimen to change your feeding time. And certainly, if you find that it improves your sleep quality, that is a good thing. What I would say is that the purpose of placing the feeding time at the end of the day is because of all of the hormonal and metabolic effects that feeding tends to have. Number one, that is, feeding tends to induce a sense of sedateness. Um, the other thing is in terms of productivity, because feeding demands a considerable amount of energy in terms of processing. If one considers when is the best time to feed in terms of maximizing productivity, it is at the end of one's productive day. So for me, I would not engage in eating during a time where I could be productive physically or mentally. So that is another driving factor behind the timing of the Amen main meal. But you can, consider that, integrate that information, and then align your individual regimen how you see fit within the broad confines of the Amen regimen.
Okay. Let's see. Jay asks, what is your chronological age, doctor, and what age did you begin implementing your regimen at, or for how long should I say?
I'm presently 50, and I began the almond regimen in around 2000. So I've been on the regimen for a quarter century.
So what age was that?
25. So I've been on the regimen for half my life at this juncture.
Greg says, talking about tea, I've been taking moringa tea and seeds during my fasting period for about 2 years, and I find them incredibly helpful. They contain amino acids and also regulate caffeine levels and help clean the organism on many levels. Have you experienced anything with this amazing plant?
I have used it. It's good. Continue to do so.
Isabel, thoughts on burdock root?
I have seen good things about it. The research is interesting. I have not integrated it formally into the almond regimen, but I'm continually researching, continually studying, and continually learning.
Okay. Soul Rebel basically explaining what GABA is. It's really long though.
Okay.
But she says she can't copy paste the info on Google, but read up on GABA, a neurotransmitter that reduces stress, and a lot more. Will help to keep the stress levels low. I have to go. Love you all. Keep up the good work.
Thank you. I'm familiar with that inhibitory neurotransmitter, and I will do more research on it, and I shall endeavor to reduce my level of stress.
Hmm. Jay says strictly following it for a quarter century and no deviations. As far as what I've gathered, that is impressive. I tip my hat.
Thank you, Jay. I appreciate that acknowledgement.
Following up with that, he said, would you have any particular suggestions in rebuilding ocular strength, exercises, and feeding regimen to measure enhancement for those who have been using glasses for many years? Pardon the shift in topic.
That is a shift in topic, but one that is particularly interesting to me. Um, I don't know if you have read volume 1 of Air, but one of the first changes of note that I experienced was an improvement in my eyesight. At the start of the regimen, I also wore glasses. I was in medical school at the time, and from my seat, I could not see the board without my glasses. And this was in the beginning of the semester. By the end of the semester, when I had only been on the regimen for some months, I was astounded one day when I was reading the board without my glasses. And I immediately, uh, that was an immediate reinforcement for the benefits of the regimen. I had to wear glasses at night when I drove at the time, and I did not need them. So I would say that the regimen is quite capable of inducing a profound beneficial effect on eyesight and eye health. I can't make any claims beyond that. I have not committed it to empirical study. This is just an observation that I've had, and I don't know how many followers have had a similar experience. But I would also ask you how long you have been on the regimen, and I can conservatively say that I would expect your eyesight to improve if you consistently and rigorously practice the regimen.
That it had to do with like when you fast and stuff and your glycemia is lower, that improves your eyesight because you're not like glycating your body.
That's a very good point. So, what New said, if she would like me to repeat it, or you can feel free to repeat it yourself, she mentioned the beneficial effect of the regimen, particularly the almond fast, on glycemia. And because many ocular complications have to do with the glycation of the fine proteins in the lens, the immediate alleviation of advanced glycation in products, so their reduction can have what seems to be a profound, immediate, early effect on eyesight. I think another one may have to do with blood pressure, oxidative damage. So in all of these respects, I think that the almond regimen is an ideal way to, again, not simply prevent eye problems, but to treat them once they have been entrenched, so to speak. I think we have time for
Maybe two.
a couple more questions. Okay.
8 more minutes. Any more questions?
If you are interested, I anticipate that the completion of this particular tractate 4 of volume 2, will be in mid-December, if not sooner.
Is it 2-4? It's not 2-5.
I believe it is 2-4.
Oh, cool.
So it is glycation, carbonylation, carbamylation, which is tractate 1 of volume 2. Then there is telomeres, and then there is temperature. So this is the 4th on autophagy.
Okay. Let's do like a speed answer.
Okay,
Okay. Alfonso, do you presently track any biomarkers like sleep quality, HRV, or VO2?
that's a good question. No. With a caveat, I do occasionally check my blood glucose level, but besides body weight, body temperature, and glucose concentration, those are the ones that I consider to be most important. So no, I don't check any besides those.
Okie dokie. Jay says, articulate and precise as ever. Thank you for accommodating my shift in topic, as I mentioned. Highly appreciated the feedback.
I appreciate your participation, Jay.
It's all kind of like related, though.
Yes, I think so.
Greg, doctor, was most of your musculature developed before starting the almond regimen? I like that almond regime.
The answer to that question is no. I would say that the highest proportion of muscle that I amassed was on the almond regimen. And that was both in terms, well, in terms of absolute body weight, I was about 250 pounds in my early adulthood. And when I became a vegetarian, I shed a lot of weight. I went down to about, I would say, just above 200 pounds. But that wasn't particularly muscular. It wasn't really until I implemented the almond regimen that my muscle density and my muscle strength substantially improved. And when I say strength, I like to objectify that, operationalize that, if you will, because I consider and conceive strength as a function of body weight. So, and this is, of course, consistent with powerlifting, wherein an individual competes at a particular body weight in a particular weight class. So, presently, I would say that I am at my highest relative strength. So my strength factor is as high as presently on my particular, I would say, signature lift, which is the deadlift. That is important too, because I consider the deadlift to be the best indicator of pure power, more strictly speaking, pure strength. But in my previous weight class, which was the 82.5 kilogram class, though my world record deadlift was over 670 pounds, my strength factor was greater at my second and third world records, which are in the weight class of 75 kilograms at around 617 and 622 pounds, respectively. I know that my answer has much to do with strength, but I think it's relevant to muscle as well, because I'm as interested in the preservation of muscle strength as I am in the preservation of muscle mass. And I discussed this in volume 4, tractate 2, the prolongevity power of resistance in the context of the new and evolving definition of sarcopenia to encompass the preservation, not really the preservation, but incorporating muscle strength as well as muscle mass into the conception of that particular condition, sarcopenia. That was a convoluted answer, but I hope it hit the mark.
Okay, 2 minutes. Okay. Doctor. No, you said that already. Okay. Hi, how to activate the vagus nerve? Quick, quick, quick. How do you activate it?
Stay active.
Stay. That's your answer?
Yes, I don't want to be dismissive, but I don't think there is a particular way of activating the vagus
Isn't
nerve.
it already active?
Yes.
Are you alive? Okay. Jacob, 3 to 4 hours of sleep normal.
Is that normal? I would say, according to the research that I've seen, it is not ideal. And I would suggest that you sleep the maximal amount that you need in order to be recuperated and rejuvenated and revivified. I don't recommend sleep restriction, but it is simply the case that I'm able to make do and function properly with far less sleep than I did before starting the Amen regimen. But I always ensure that I sleep as much as my body feels the need for, and I do not arbitrarily restrict the duration of my sleep.
Mm, 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 mm. Okay. Jay says another side note and topic. I also admire the dynamic you two share, you and your partner. I mean, beautiful to see. Always great to see inspiring relationships.
Thank you. I appreciate that.
Okay. Would you advise the usage of the elixirs on days where you can't lift?
So, to address that question,
Sorry, but we have less than 1 minute.
okay, there are no days when I don't lift. Even on holidays, we continue with the regimen, both the persistence and the resistance phase. And we always have the elixir and never omit it, except there is the minimus, if you are not familiar with that.
We should talk about that next live.
Yes, so I might talk about the distinction between the maximus and the minimus variants of the Amen amino elixir. And once again, I thank you all for your participation and for your excellent questions. And I'll see you in about a month.
Bye.